The other kind of stroke is called a hemorrhagic stroke. So that's a bleeding stroke. A blood vessel in the brain, or there's a mechanism for the bleed that this bleeding happens, it occupies part of the brain, and that mass effect and occupying of the brain causes a stroke or the symptomatology. It's still a damage to that part of the brain when the bleeding happens. There are different reasons of why a hemorrhagic or bleeding stroke happens into the brain. Most of the time, unfortunately, it's high blood pressure. And that's why it's extremely important for patients, and I counsel them to watch their blood pressure, work with their doctors, primary care doctor, internal medicine doctors, to get that pressure under control. The other causes for this hemorrhagic stroke is from use of drugs such as cocaine and things of that sort. Folks who smoke cigarettes quite a bit, they weakens the blood vessels, and unfortunately aging itself can cause that. Once you have a bleeding stroke, I want to talk about the symptoms of what it's like. It could be very similar to the other kind of stroke called a ischemic stroke. So again, we go through that. The face can be drooping, it could be numb on one side, there could be weakness on one side of the body, numbness, tingling, heaviness. Your speech can be affected where you can't get the words out. So you can't tell just by symptoms which one it is. The way that we diagnose this is that you come into the hospital, and again, I advocate that call 911, don't wait, as soon as possible get to the emergency room. We most of the time do a CAT scan of the head, which is a scan of the head to see is there bleeding to the brain. Once we document that bleeding into the brain, there are a subset of patients who do not need any surgery or intervention. With time, actually, that blood clot into the brain just decreases and the brain starts healing. There are a subset of patients that a surgery is needed, and it's actually a life-threatening issue for them, so they need urgent surgery. And we have conventional ways of doing surgery where we actually have to make a larger incision, go in, and sometimes remove the skull to take out the bleed in the brain. We have newer technology through very minimally invasive ways, by small incisions, small holes, through small instruments where we can evacuate and take out that blood clot, and we actually offer those types of surgeries here routinely. We're a primary stroke center. We have dedicated stroke neurologists, and what they concentrate on is treatment, helping patients who are having strokes or who are at risk of stroke. We have 24/7 coverage with doctors who subspecialize in treating patients who are having a stroke through a surgical method, through an endovascular method. So going through the blood vessel with catheters, wires under sophisticated x-ray, and extracting the blood clot out of the brain. We have a whole team in a neurosciences dedicated ICU who concentrates on patients who have had stroke. Our neurointensivists, our nurses, our therapists, a whole team, pharmacists, a whole team that concentrates on stroke patients. And being in the stroke belt, we are able to provide all the comprehensive therapies and surgeries and so forth for the population in this area in the Midlands and the state of South Carolina.